Welcome to the Deep Dive, your shortcut to being genuinely well-informed. Today, we're cutting through some really deeply ingrained myths about one of the most serious health events, heart attacks.
Yeah.
Forget those, dramatic chest-clutching scenes from Hollywood, because for many, especially older adults, a heart attack looks nothing like that. It can be incredibly subtle, even silent.
That's right.
We've pulled some really compelling sources to help us unpack these hidden signs, give you an absolutely critical action plan if you ever find yourself alone during an emergency, and then, chart the path to long-term heart health for seniors.
And the urgency of this topic is undeniable. With our global population steadily aging, understanding the unique cardiovascular challenges faced by older adults isn't just academic, it's fundamental, really, to our collective well-being. The nuances we're about to explore here could genuinely make a life-changing difference for you or someone you care about.
Okay, let's unpack this then. Let's dive right in with a statistic that might genuinely surprise you. Every year, over 730,000 adults experience heart attacks in the United States alone.
That's a huge number.
It is. But here's the picker. Up to 25% of those begin with what our sources call silent symptoms. No severe chest pain, none of the typical dramatic indicators.
Right.
And the data shows, for older adults, that percentage is significantly higher.
It's a striking difference, really. For patients over 85, a significant 43.2% experience myocardial ischemia, that's reduced blood flow to the heart muscle without any classic chest pain.
Wow, almost half.
Almost half. Compare that to just 11.1% in those under 65. This raises an important question. Why are older adults experiencing heart attacks so differently? Why does the textbook scenario so often, not apply to them?
That's precisely what we need to understand. If it's not always crushing chest pain, what are the body's real emergency signals? Our sources detail 6 common, often hidden signs of a heart attack in aging adults. First, generalized fatigue. This isn't just being a bit tired. We're talking about an unusual severe exhaustion that makes even simple daily activities feel utterly impossible.
Right, like you just hit a wall.
Exactly. It's particularly common in women and happens because diminished blood flow forces the heart to work much harder, leading to this overwhelming tiredness. Second, sore back, chest, or arms. You might feel aches or discomfort in your upper body without any prior physical activity to explain it.
So not like you just worked out or something.
No, exactly. This happens because your brain can sometimes misinterpret pain signals from the chest, referring them to other areas instead.
Okay, referred pain. Got it.
Third, jaw, neck, or throat discomfort. This could be tightness or pain in these areas, even if there's no accompanying chest pain. Some older adults even describe a choking sensation. For women especially, that jaw pain can be a really key indicator.
Interesting. That's quite specific.
Fourth, difficulty breathing. If you find yourself unusually short of breath during light activities like walking across a room, climbing a few stairs, or even upon waking from sleep, and this isn't normal for you, that's a serious red flag.
So a change from your baseline.
Definitely. Fifth, nausea. Nausea, vomiting, and profuse sweating can all be signs. This is due to reduced blood flow to the abdominal region.
Okay.
Listen closely. For women, nausea can sometimes be the only symptom of a heart attack.
The only one. Wow.
Yeah. And finally, sixth, upper abdominal pain. This might feel like a persistent dull pain or a heaviness in your upper stomach. It might or might not include chest pain.
Sounds like indigestion.
Exactly. It's often tragically mistaken for indigestion or heartburn, especially if accompanied by burping. But if antacids don't bring relief, that's a red flag that warrants immediate medical evaluation.
That's a crucial distinction. Antacids not working. So the scientific why behind these atypical manifestations is critical. As we age, our pain perception can change, making heart attack pain less acute.
Less intense, you mean?
Less intense, yeah. In fact, pain is often the last symptom in the ischemic cascade. That's the sequence of events leading to heart muscle damage.
The last.
This means significant cardiac damage can occur before any discomfort even registers.
So the damage is already underway, but the body isn't sending the usual distress signals. That's a terrifying thought.
Precisely. And then there's the influence of other common conditions in older adults that can mask or alter symptoms.
Like what?
Well, diabetes, for instance, can lead to neuropathy, which reduces pain sensation. Even neuropsychiatric conditions like depression and dementia can impact an individual's ability to recognize or, accurately report new symptoms.
I see. So other health issues muddy the waters.
They really do.
Yeah.
If we connect this to the bigger picture, This complexity means that clinicians must be incredibly vigilant and consider rigorous additional tests when evaluating older patients, even in the absence of traditional symptoms.
Right.
The key insight here: for older adults, a heart attack isn't just silent, it's a master of disguise. If you're over 65, forget the chest-clutching drama. Your body's subtle whispers are often the real emergency sirens.
That truly redefines what we should be looking for. But recognizing these hidden signs is just the first step. What happens in those terrifying moments when you suspect a heart attack and you're completely alone?
Yeah, that's the critical question.
That's where a clear action plan becomes absolutely life-saving. Our sources share a compelling story of Ramadi Jaida Sen, a 77-year-old woman who survived a heart attack while alone because she knew exactly what to do.
Preparation makes all the difference.
It really does. The difference between a nearly 90% death risk and a 92% survival probability often comes down to preparedness.
And that preparedness starts even before the full event. Heart attacks don't usually just hit out of the blue. They often give warning signals.
Okay, so there are clues beforehand.
Often, yes. Recognizing these can be your first line of defense. Here are 5 crucial pre-attack signs to look out for. First, chest pressure or heaviness. This feels like a stone on your chest, a squeezing or fullness lasting over 15 minutes, and it's not relieved by typical remedies.
Not like heartburn that goes away.
Exactly. Second, radiating pain. This pain can spread from the chest to the left arm, sometimes both arms, to the throat, jaw, especially for women, remember, or your upper back. Don't mistake jaw pain for a simple toothache.
Right.
Third, extreme fatigue without cause. A sudden, overwhelming tiredness, a deep exhaustion where your body just feels like it can't move is a surprisingly common yet often dismissed symptom, especially in women.
That fatigue again.
Yes. Fourth, sudden shortness of breath and cold sweat. Even when you're at rest, this can be an alarming sign, frequently mistaken for an anxiety attack. And fifth, dizziness, nausea, or vomiting. Don't dismiss these as simple indigestion. If they occur suddenly and without a clear dietary reason, they can be critical early indicators of a heart attack.
Okay, 5 warning signs. And it's important to remember, you don't need all 5 signs.
No, absolutely not.
Even 2 or 3 are enough to strongly suspect a heart attack.
Okay.
And if you have known risk factors like high blood pressure, diabetes, high cholesterol, or a history of smoking, even one of these signs warrants immediate action.
The message here is clear. Err on the side of caution. Your body is telling you something. Listen to it.
Okay, now let's get into the specifics of what to do if you're ever in that terrifying position, alone, suspecting a heart attack. Here's where it gets really interesting. Our sources have distilled an 8-step plan that could genuinely save your life.
Okay, let's hear it.
Number 1, stop activity and tray. Sit safely. Immediately stop what you're doing and sit down in a stable, supported position like a chair with a straight back. Remember Jaida Sen? She sat on a bench by her door, preventing a fall.
Smart. Stability first.
Number 2, chew 100 milligram aspirin. Safe. If you have aspirin and no allergies or gastric ulcers, chew a 100 milligram tablet immediately.
Chew, not swallow.
Yes, chew. It gets it into your bloodstream faster to reduce blood clot formation and potentially decrease heart damage by up to 40%.
Wow, 40%? That's significant.
Huge. Number 3, call emergency services and state full address clearly. As soon as the call connects, clearly state your name and complete address. If you lose consciousness, this vital information ensures paramedics can still find you. Stay calm and don't hang up.
Crucial. Address first.
Number 4, open your house door and make key code visible. If paramedics arrive to a locked door, precious minutes are lost. Prioritize your life over property security by ensuring easy access. Unlock the door, put a key somewhere obvious.
Makes sense. Time is muscle.
Number 5, recline at 45 degrees with slightly elevated legs. This position helps optimize blood circulation to your brain and heart and reduces stress on your lungs and circulatory system. Avoid lying flat or sitting completely upright.
So, sort of halfway between sitting and lying.
Exactly. Number 6, send a short text message to family friends. Avoid lengthy phone calls that take effort. Send a concise text, something like heart attack symptoms, called emergency, going to hospital, to multiple contacts to ensure someone sees it.
Quick and efficient communication.
Number 7, practice deep, controlled breathing. Inhale slowly through your nose for 4 seconds, then exhale slowly through your mouth for 6 seconds, breathing from your stomach. This calms your mind and improves circulation.
Good advice for any stressful situation, really.
True. And number 8, press inner wrist and cough vigorously 3x. Use your thumb to firmly press the inside of your wrist where you feel your pulse, and at the same time, cough forcefully 3 times.
Okay, what does that do?
Apparently, this stimulates blood flow and helps regulate your heartbeat, buying crucial minutes until help arrives.
Interesting. A sort of self-help maneuver.
Yeah. These steps aren't a cure, obviously, but they are a vital bridge. They're about buying time that, as Jada Sen's story shows, can be the absolute difference between life and death. The profound takeaway from these steps isn't just about survival. It's about realizing your own agency. Those first critical minutes alone are where you become your own first responder, potentially shifting that nearly 90% death risk to a 92% survival probability.
It truly emphasizes the power of preparation in those critical, isolated moments. It's empowering in a way.
Absolutely. So beyond those crucial first minutes of crisis, a heart attack is just the beginning of a journey. What does long-term recovery and even better prevention look like for older adults?
Right, because the immediate event is just one part. That's where we pivot to a holistic and personalized approach. Let's talk about cardiac rehabilitation, or CR.
Okay.
This isn't just about exercise. It's a comprehensive intervention that includes health education, advice on cardiovascular risk reduction, physical activity, and crucial stress management.
So it covers a lot of ground.
It does. And the research shows CR reduces all-cause mortality by 27%, CHD mortality by 31%, and significantly cuts down on unplanned hospital admissions. Plus, it greatly improves exercise capacity, quality of life, and psychological well-being.
Those are impressive numbers.
Yeah.
And are we seeing more older adults benefiting from these programs?
Absolutely. There's been a notable demographic shift. The mean age of CR patients in the USA increased from about 60 to over 63 years, and the proportion of patients 75 or older rose by 59%.
Wow.
This highlights the growing need for specialized approaches. That's where the comprehensive geriatric assessment, CGA, comes in.
CGA.
Yeah, CGA. This personalized approach evaluates not just the cardiac condition, but also physical, cognitive, and social factors to create a truly tailored rehabilitation plan.
Tailored to the individual older person.
Exactly, because older adults are an incredibly heterogeneous group, right? Ranging from robust and independent to frail and dependent. You can't have a one-size-fits-all plan.
That makes sense.
And what's fascinating here is how CR has been shown to improve physical performance even in very old patients, those over 75, especially individuals who started with poorer baseline function. It truly shows that it's never too late to benefit.
It's remarkable to hear that even at advanced ages, these interventions can make such a difference. It really underscores that it's never too late to invest in heart health.
Never.
But beyond recovery, what about preventing these events in the first place, especially for older adults, given their unique challenges?
Yeah, prevention is key. Cardiovascular prevention for older adults presents a unique challenge because current guidelines often lack specific recommendations for patients 75 and older.
Why is that?
Well, this age group is typically underrepresented in clinical trials, so the evidence base isn't always as strong for them.
Okay.
This necessitates an individualized approach that meticulously considers geriatric syndromes like frailty, dependence, cognitive impairment, and polypharmacy, taking multiple medications when setting treatment goals. We have to look beyond just chronological age.
Right, look at the whole person. So what does that individualized approach look like in terms of managing common risk factors for seniors, like cholesterol?
Okay, for dyslipidemia, or high cholesterol, current guidelines often suggest the same LDL-C targets as younger patients, for example, less than 55 milli-GDL for very high-risk individuals. Statins remain the first-line treatment, and newer drugs like bempedoic acid and inclisiran have shown significant benefits in older populations as well.
And high blood pressure, hypertension.
When it comes to hypertension, treatment is generally recommended for systolic blood pressure of 140 millibradiol Hg or greater in patients 75 and older, or 160 or greater in those 80 and older, with a target usually between 130 and 139 millimilli Hg.
But there sounds like a but.
There is a but. Careful monitoring is crucial, especially in frail patients, due to the increased risk of hypotension, low blood pressure, and falls. You have to balance the benefits with potential risks.
Okay. What about diabetes?
For type 2 diabetes, the focus shifts to prioritizing medications with proven cardiovascular benefits, like GLP-1 receptor agonists and SGLT2 inhibitors. These are newer classes of drugs that help manage blood sugar and offer direct protection to the heart and kidneys.
That's a double benefit.
Exactly, but again, for frail patients, less stringent HbA1c targets, that's your average blood sugar, are often considered to avoid dangerous hypoglycemia or low blood sugar.
Makes sense. And smoking.
Tobacco cessation is strongly advised regardless of age. Quitting smoking provides benefits at any point in life, significantly reducing cardiovascular risk. It's never too late.
Good to know. Beyond these medical interventions, what about the crucial role of care at home after a heart attack, perhaps from family or caregivers? That seems really important.
That home care environment is paramount for successful recovery. Absolutely critical. First and foremost, there's strict adherence to doctor's orders. This means diligently following medication schedules and actively participating in cardiac rehabilitation. No skipping doses or appointments.
Okay, makes sense.
Secondly, making daily life easier. For the 1 to 3 months of recuperation, providing support with physically demanding tasks, housekeeping, laundry, maybe even personal care like dressing or bathing, significantly reduces stress on the heart.
Taking the load off, literally.
Literally. Third, supporting lifestyle changes is key. This could involve assisting with meal planning and choosing heart-healthy foods, maybe acting as an exercise partner for gentle walks, or simply offering encouragement for quitting smoking, being that support system.
Right. And
Finally, constant vigilance. Family and caregivers need to remain alert for any signs of a second heart attack and be prepared to call 911 immediately if symptoms reappear. Know the signs we discussed earlier.
Okay, that vigilance is key. And speaking of heart-healthy foods, let's briefly touch on the long-term impact of diet. What should our listeners be focusing on?
Diet is absolutely foundational, and it's really about building sustainable habits focused on adding nutrient-dense foods rather than just, drastic cutting out.
Adding good stuff, not just removing bad.
Precisely. Aim for maybe 25-30 grams of high-fiber whole grains daily. Think oats, whole wheat bread, brown rice, plenty of whole fruits and vegetables. Choose the whole fruit over juice for that crucial fiber.
Fiber's important.
Very. Include maybe 20-30 grams of unsalted nuts, daily almonds, walnuts, good fats there, and lean proteins, making sure to have fish perhaps 2 to 3 times a week. Think salmon, mackerel.
Omega-3s.
Exactly. And of course, minimizing ultra-processed foods, those high in sugar, salt, and unhealthy fats, is also a key habit to cultivate for long-term heart health.
Right.
Read the labels.
Good advice.
Yeah.
So we've covered a lot today, from the surprising silent signs of a heart attack in seniors to the critical immediate steps you can take if you ever find yourself alone, and the comprehensive long-term strategies for prevention and recovery. What it really boils down to is, it feels like a paradigm shift in how we approach heart health for older adults.
It really does. It means that knowledge truly is power. Understanding these nuances, especially the atypical symptoms and the tailored care needed for older adults, empowers you to be an informed advocate for yourself and your loved ones.
Right.
Being aware allows for timely action, which can change outcomes dramatically and enhance not just longevity, but also quality of life, independence.
So what does this all mean? Take a cue from our sources. Maybe go to your fridge right now, grab a piece of paper, and write down, "I am prepared." Practice those 8 immediate steps. Mentally walk through them.
Internalize them.
Yeah. This isn't just information. It's preparation. It's prevention. It's a profound commitment to your own well-being.
Absolutely. And maybe a final thought to leave everyone with. As our population continues to age and cardiovascular disease remains a leading health challenge, how can we ensure that every older adult, regardless of their circumstances, receives truly personalized, multidisciplinary care that prioritizes not just longevity, but also quality of life, independence, and dignity? This is a question that challenges us all, I think, patients, families, healthcare systems, to really rethink healthcare delivery on a societal level.